Well, leadership from the Henry Ford Health System and Beaumont Health have warned our currently increasing surge is having serious effects on hospital operation and the ability of everyone, whether they have COVID or not, to get care.
And today, Michigan Medicine added their voice to this growing chorus of concern. Dr. Frank McGeorge now with more on what they're seeing. Doc?
Yeah, Kim and Devin, I've said this before. Staff shortages that didn't exist before COVID, the absence of any meaningful state-mandated public health requirements like the ones we saw at the start of the pandemic, and frankly, an overall attempt by hospital systems to maintain care for non-COVID illnesses all mean that this current surge is just breaking the back of the healthcare system, and it hurts everyone.
It's a dire situation across the state right now. The state of Michigan reached a record high of hospitalized COVID-19 patients this week, the highest number since the very beginning of the pandemic, now more than a year and a half ago.
That's Dr. Marshall Runge, CEO of Michigan Medicine. He points out that while the situation is dire, one fact stands out.
As you'll be able to see in this graphic, the overwhelming majority of hospitalized COVID-19 patients are unvaccinated. What I'd like to point to is on the right side of that slide, none of the patients on ventilators have been vaccinated.
And the surge of COVID patients has a devastating downstream effect.
People have died and will die of non-COVID-19 disease in our area, across the state, and across the nation because COVID-19 is overrunning hospitals.
Dr. David Miller, president of University of Michigan Health, says shortages are only making matters worse.
At Michigan Medicine, we are continuing to cancel surgeries because we just don't have the beds. This week alone, we've canceled more than 40 cases. Staffing shortages are also impacting access. For example, here at Michigan Medicine, we've had to close several much-needed beds in some of our critical care units. And fewer appointments are now available for patients eligible to receive monoclonal antibody treatments that can reduce hospitalizations and death for some patients with COVID-19.
So here's the bottom line. The healthcare system is at a breaking point. I see it every weekend I spend in the ER. Patients waiting to be seen, waiting to be admitted, or frankly leaving because they cannot wait any longer. We, the healthcare system, are doing everything we can, but we desperately need everyone to step up and protect yourselves from COVID.
Frank, it feels like we are kind of back at a point. We haven't used this phrase in a long time, but at the beginning we talked a lot about flattening the curve. We're right back there again, aren't we?
Yeah, absolutely. The big difference was 20 months ago, we only had the blunt tools of stay-at-home orders and widespread closures. Now we have a vaccine that works, but we need everyone to get it. Now we know masks help, and we have plenty of them, but we need people to wear them. The state has no interest in mandates. That's pretty clear, and that's fine. But that puts the responsibility on citizens like us to do our part.
It sure does, especially with all this fatigue that has set in, and we're kind of taking our eye a little bit off the ball, no doubt about it. All right, Frank.
The Detroit Police and Fire Pension Fund say they are not suing businessman Dan Gilbert for alleged insider trading.
This is a wild turnabout. A civil lawsuit claimed Gilbert had insider information when he sold $500 million in Rocket Company stock back in March. The Detroit Police and Fire Pension Fund was named as a plaintiff in the lawsuit, and officials now say the fund was named in error, and they are withdrawing the suit.